The most exciting advancement in cancer research has been around immunotherapy. This world of being able to manipulate cells outside the body, put genes in them, and then return them to the body so that they can be weapons in the war on cancer. These genetically modified cells can sniff out cancer cells and execute them and kill them. I worked for about 10 years at MD Anderson Cancer Center, and there I was head of pediatric transplant. And I had a large laboratory working on cell and gene therapy. And we were very interested in making these killer T cells that recognize cancer cells. I invented some new ways of producing killer T cells, as well as other technologies around immunotherapy. And that then got licensed in the largest deal in MD Anderson's history to two companies, Intrexon and Ziya Farm. And as part of that licensing deal in 2015, I then became Chief Executive Officer of Ziya Farm Oncology, and that's what I do now. So for the last almost 11 months, I'm now CEO of a publicly traded company. The marriage of academic science and biopharmaceutical industries is accelerating, especially around the world of cell and gene therapies for cancer. And my own example, I think, is that as CEO of a publicly traded company, I came out of academics, and I think we're seeing more and more. I may be a little unusual in that I made the cross to CEO, but there's plenty of technologies now that are crossing that bridge based on the science. So there's a large appetite now by biopharmaceutical companies to understand the basic immunology and immunotherapies of cancer and then commercialize it. The futurescape of immunotherapy and cancer looks really bright. We're just at the beginning of the story. There's been already Lazarus moments. Patients really have been on death's bed and then have received these cell-based therapies and what we think have been cured. The question now with these sort of vignettes is how many other patients can benefit from this type of biology. So the future is one in which we're starting to understand, can we target not just leukemias, but can we target other tumors? Can we target tumors in the elderly, in the young? Can you target tumors early in the disease narrative of a patient rather than when they're at the end, potentially, of their life story? So that's where the field is going, and to get at that, it's where companies like mine and academics really have to pull together to develop not just monotherapies, not just killer T cells, but killer T cells that work in constellation with other therapies, cytokines, NK cells, viruses, and so forth and so on.